Hey guys, so this is your girl Letitia B. Fikes. I am your hair loss practitioner and I'm trying to help you today, guys. So, um, two things. If you are experiencing hair loss due to your birth control, comment below hair loss. Comment hair loss. If you are experiencing hair loss due to your birth control and you would like to have a free 15-minute consultation, comment below consultation. Okay, so is your birth control causing you to have hair loss? So let's break this down some. Hair loss and alopecia, same difference. Hair alopecia is a technical term that we use that simply means hair loss. Okay, so when we dealing with your birth control, it's to disrupt that whole hormonal thing that's going on with your body so we can kind of trick your hormones so you won't get pregnant. That's basically, we just trying to trick your body so it won't produce certain things, so it won't activate, so you won't get pregnant. That's basically what it means. So the female hormone that's present in the body during a natural occurrence is estrogen. Well, when you on birth control, you increase the testosterone hormone. Okay, so by making these changes in women, it causes to be imbalanced. And when things are imbalanced, it disrupts a lot of things going on in the body. The body have to get adjusted to this new cycle, and it has to regulate in a new normal, as well as your hair. So your hair cycles is disrupted. So when it's disrupted and can't function right, it stops producing hair. Hair grows at a slower rate. um a lot of testosterone is is in production, and it has a conversion rate to where it converts to DHT, and then now DHT is attacking your hair strand. Now your hair strands are miniaturizing, and when this is occurring, you either have your hair appears to be more thinner, or your hair just stop producing altogether, and you're start to see more skin than anything. So you do things to camouflage this. Maybe if it's in the center, you start wearing extensions. Now you having hair loss because of extension, or if you wearing wigs, you having hair loss to the commercial hair that you getting installed. So it seems like you can't win no way around this, which I'm here to tell you you can. There are certain steps and certain protocols you need to put in place in order to stop and reverse some of this hair loss. Hopefully that is not lost. When you're dealing with a hormonal issue, the thing that you need to do is correct the hormonal imbalance. And you want to make sure that you deal with this before scarring is taking place. That's the thing. It's like a time release capsule that's just set off soon as you start having hair loss issues. It's like, you know, you want to make sure that the hair bulb remains active. Activity is still flowing. You want to make sure that the hair that is still on the head is still being treated um fairly. It's still being um the word I want to use. You still providing nutrition to the hair that's still standing. Because it seemed like once we start dealing with hair loss, we just don't provide any care to the remaining strands that's on the head. So if you are dealing with hair loss, I'm sure you're probably seeing, and then on top of that, because you are losing hair because of the hormonal issue, and maybe it could be some type of from side effects from the medicine itself. Um, because of this is going on, you probably stressing too. So on top of that, in addition to hair loss due to hormonal imbalance because of the Depo Provera, you also have telogen effluvium going on, which is a type of hair loss that induced to anxiety and stress. So the first thing you probably want to do is to reduce the stress. Stop stressing. Find some things that you can do to reduce stress. Probably start doing some yoga. Start breathing, taking some deep breaths. Start you know doing a better lifestyle change overall. um I'm trying to make sure that I have all my topics. I just really wanted to come on here because I know, especially if you have teenage daughters, and the quickest thing that I've seen parents do, like, oh, you graduate and get on a shot. Oh, you just turned 14, get on the shot. And you don't even look into the side effects. You just know my daughter is not getting pregnant. Or if you old enough, you just know I don't want any more babies. But I want you to um dig more into that and seeing what you're doing to the body. You disrupting the whole cycle. And I'm not just talking about the hair cycle. I'm talking about the way the body system is supposed to function. And when a woman can't produce or flow how they supposed to, it causes other problems. So in that case, and not telling you not to get birth control, you kind of weigh your options, the risks and benefits when it comes to that. Well, I'm not going to dive into that today. What I am going to do, I'm going to talk about the hair loss. So if you are experiencing hair loss due to Depo Provera, type in below hair loss. But if you would like to talk with me more about your hair loss, you can talk to me on a free 15-minute consultation. You can talk to me on the paid consultations, a full consultation where you send me pictures and we dive into your medical history and I create a custom treatment plan for you. We can do a virtual one. Is My virtual plan is actually $100, but I am currently, because this is Alopecia Awareness Month, I have a promotion going on for 50% off. So currently the virtual consultations are $50. Then you can come see me in clinic. And in clinic is 225. And if you pursue back on. So if you pursue a treatment plan, the money for your consultation goes towards your treatment plan. So, again, I am Letitia B. Fikes. I want to thank you all for watching, especially if you are currently watching. I appreciate you. And if you are watching on a replay, thank you for watching as well. I did something. So I am Letitia B. Fikes. I am your hair loss practitioner. And until next time, guys, you stay educated.